Let's get right into it. Number 10. Trepanation Drills. Imagine you have a headache so bad that someone looks at you and says, "Have you tried a hole?" Not a metaphorical one. A literal hole. In your skull. Welcome to trepanation, one of the oldest medical procedures on Earth, and also one of the fastest ways to make modern doctors lie down on the floor and stare at the ceiling. Thousands of years ago, people believed headaches, seizures, and mental illness were caused by evil spirits trapped inside your head. The solution was simple: open a window and let the demons out. So ancient surgeons grabbed what looks suspiciously like a hand-powered drill or a sharpened circular saw and went to work on your skull like they were installing ventilation. Here's the horrifying part: a lot of patients survived. Archaeologists have found skulls with smooth bone regrowth around the hole, which means not only did the person live, but their body looked at the situation and went, "Well, I guess this is normal now." No anesthesia. No germ theory. Just someone scraping bone while you tried not to pass out and reconsidered every life choice that led you there. Psychologically, this worked sometimes because the brain is extremely easy to gaslight. Pain relief after the procedure could happen due to pressure changes, placebo effects, or the fact that your brain was too busy screaming about the hole to worry about the original problem. Basically, your nervous system got distracted by a bigger emergency. So yes, trepanation drills look like medieval torture devices because they absolutely were. The difference is that everyone involved genuinely thought they were helping. Nothing says ancient medicine like solving mental health issues with power tools. Number 9. The Bloodletting Lancet. If ancient medicine had a personality, it would be deeply committed to the idea that you have too much blood and that's your whole problem. Fever? Blood. Anxiety? Blood. Stubbed your toe? Believe it or not, also blood. Enter the lancet, a small, razor-sharp blade that looks like it belongs in an assassin's boot, not a doctor's kit. Bloodletting was based on the theory of the four humors: blood, phlegm, black bile, and yellow bile. The idea was that your body was a poorly balanced smoothie, and the only way to fix it was to start draining ingredients until vibes improved. So doctors cut veins, sometimes repeatedly, and watched blood pour out while nodding thoughtfully like this was science. The wild part is how casual this was. You'd sit there while a physician opened a vein in your arm, neck, or ankle, depending on which organ they blamed that week. People got so used to it that barbers started doing it too, which is why barber poles are red and white. That's not decoration. That's branding. We cut hair and occasionally your bloodstream. Psychologically, bloodletting felt effective because doing something dramatic feels better than doing nothing. You feel weak, dizzy, and different afterward, so your brain assumes improvement must be happening. In reality, you're just low on oxygen and regretting your trust. The lancet looks like a weapon because it was used like one. The only difference between healing and harm was the doctor saying, "This is for your own good," while you slowly leaked onto the floor. Number 8. The Vaginal Speculum. Now let's talk about an object that has traumatized generations while changing almost nothing about its design for 2,000 years. The vaginal speculum. Ancient versions were made of metal, hinged like a trap, and opened by cranking or spreading mechanisms that look like they were borrowed from a siege engine. In ancient Greece and Rome, physicians believed women's bodies were mysterious, dangerous, and prone to wandering organs. Yes, they thought the uterus could roam around the body like a lost animal. The speculum existed so doctors could look inside and confirm whatever nonsense theory they already believed, usually while ignoring the patient screaming. There was no concept of patient comfort, or consent, or privacy. The tool wasn't designed to help the person on the table, it was designed to satisfy the doctor's curiosity. From a psychological perspective, this reflects how medicine used to prioritize observation over empathy. If the tool worked for the doctor, it was considered a success. What's truly unsettling is how little the design has changed. Modern versions are cleaner and more controlled, but the basic, metal device that pries you open while you stare at the ceiling experience is still very much alive. Your brain doesn't care that it's medically necessary, it still registers the situation as a threat. The speculum looks like a weapon because, emotionally, it kind of is. Not because it's meant to hurt you, but because it reminds your nervous system that medicine didn't always care how you felt, only what it could see. Number 7. The bone saw. There's a very specific sound that no one wants to hear while lying on a wooden table in 1750. It's the sound of a bone saw. Not a delicate, precision instrument. Not something sleek and sterile. A serrated blade that looks like it belongs in a lumberyard. Before anesthesia, amputation was basically a race. The surgeon's entire reputation depended on how fast they could remove a limb. Some bragged about finishing in under 2 minutes. Because apparently speed was the only mercy available when someone was sawing through your femur while you were fully conscious and being held down by several strong friends. The bone saw itself was brutal in its simplicity. Grip, cut, hope for the best. Infection was common, so sometimes the real killer wasn't the injury, it was the surgery. But here's the psychological twist. For many patients, this was still their best shot at survival. If your leg was crushed or gangrenous, keeping it was basically choosing death. So you chose the saw. Your brain in that situation goes into survival override. Massive adrenaline dump. Shock kicks in. Pain becomes distant, surreal, almost dreamlike. That dissociation is your nervous system pulling the emergency lever labeled, "We cannot process this right now." The bone saw looks like a weapon because it absolutely could have been one. The only difference is that instead of ending your life, it was trying to save it by subtracting part of you. Ancient medicine's version of less is more was occasionally less leg, more breathing. Number 6. The obstetric forceps. Picture giant metal salad tongs. Now imagine someone using them on a baby. Congratulations, you've just visualized early obstetric forceps. Childbirth has always been dangerous. Before modern surgical techniques and antiseptics, if a baby got stuck during delivery, the options were limited and terrifying. So doctors developed forceps, curved metal blades designed to grasp the baby's head and pull. The problem? Early designs were secret. Literally secret. The Chamberlain family in the 17th century treated the forceps like a classified military weapon. They'd bring a big box into the room, make everyone leave, and perform the procedure privately so no one could steal the design. Which means the person giving birth was alone with someone wielding mystery metal clamps near their skull-adjacent infant. When used correctly, forceps saved lives. When used poorly, they caused skull fractures, nerve damage, or worse. And because medicine at the time was very confident and not very regulated, poorly happened a lot. From a psychological standpoint, childbirth already triggers intense fear responses. Add a cold metal instrument that looks like it belongs in a blacksmith's workshop, and your brain shifts into full panic mode. Yet again, the tool looks like violence but represents desperation. Doctors were trying to reduce mortality in a world where nature was frequently winning. Forceps resemble weapons because they're designed to grip and pull with force. They exist in that uncomfortable gray area where the line between rescue and harm is razor thin. Ancient medicine loved that line. It's lived there. Number 5. The Dental Pelican. If you think modern dental visits are stressful, imagine walking into a room where the primary tooth extraction tool looks like it could anchor a pirate ship. The Dental Pelican was a curved metal instrument used from the 14th to 18th centuries, and it operated less like a precision tool and more like a medieval door handle. Here's how it worked. The metal claw braced against your gums, hooked under the tooth, and then twist. The leverage popped the tooth out. Ideally, sometimes it shattered the tooth, or cracked the jaw, or removed neighboring teeth that were just minding their business. Dentistry back then was not about comfort. It was about removal. Tooth hurts? Remove it. That was the entire treatment plan. No root canals. No fillings. Just aggressive eviction. Psychologically, tooth pain is one of the most anxiety-inducing types of pain because it's so close to your brain. So when someone approached your face with something shaped like a curved hook, your fight or flight response probably clocked in early. Your body doesn't differentiate between medical procedure and face attack. The Dental Pelican looks like a weapon because it uses leverage and force in a way that feels confrontational. It's not gently persuading the tooth to leave. It's launching it into the 1600s. Basically, ancient dentistry was less open wide and more brace yourself. Number 4. The Hemorrhoid Clamp. Let's talk about something no one in history has ever been excited about: hemorrhoid treatment. Now imagine solving that problem with what looks like a tiny bear trap. Before modern surgical techniques, doctors used metal clamps to grab, crush, and sometimes cut off hemorrhoids. The device would latch onto the swollen vein, restrict blood flow, and either cauterize it or let it wither away. The word clamp sounds clinical. In reality, it functioned like a miniature vice designed for the most sensitive real estate on the human body. There was no gentle approach, no soothing explanation, just a metal contraption approaching an already inflamed area while your entire nervous system screamed, "This feels personal." Here's the uncomfortable logic: hemorrhoids are swollen blood vessels. If you crush or cut off the blood supply, the tissue dies. Problem solved. In theory. In practice, this was excruciating and prone to infection. But compared to chronic pain and bleeding, many patients chose the clamp. Psychologically, this is a perfect example of cost-benefit survival math. When ongoing suffering outweighs the anticipated trauma of the treatment, your brain signs the consent form for you. It's not bravery. It's desperation wearing a lab coat. The clamp looks like a weapon because it uses compression and pain as a strategy. It's less heal and more neutralize. Ancient medicine had a very simple philosophy: if it sticks out, swells up, or looks suspicious, squeeze it until it stops. Number 3. The Cautery Iron. Imagine going to a doctor and instead of pills, he pulls something out of a fire. That's cauterization in its most dramatic form: a red-hot iron rod pressed directly onto flesh to burn tissue closed. Cautery irons were used to stop bleeding, destroy infected tissue, and seal wounds. In a world without antibiotics, infection was the real villain. Burning a wound was sometimes the only way to sterilize it, because bacteria don't enjoy being flash-fried. But let's not romanticize it. This was literal branding. The smell of burning flesh. The scream. The smoke. The iron hissed against skin like a cooking pan. It looks like a torture device because visually, it's identical to one. Yet biologically it made sense. High heat denatures proteins and kills microbes. It also seals blood vessels. In emergencies, this could be life-saving. Your body, however, interprets it as catastrophic damage. Massive pain signals. Adrenaline spike. Cortisol flooding your bloodstream. Your brain goes, "We are being attacked by fire," because technically you are. There's something brutally honest about cautery. No subtlety. No illusion of comfort. Just raw cause and effect. Pain now, survival later. It looks like a weapon because it is one, just pointed in the direction of your own survival. Number 2. The Lithotomy Position Frame. Imagine being strapped into a wooden frame that spreads your legs apart while a room full of people watches. That's the lithotomy position, used for bladder stone removal and other pelvic surgeries. The frame itself wasn't just a table, it was a restraint system. Bladder stones used to be incredibly common and incredibly painful. Removing them meant cutting into the perineal area and extracting the stone manually. No anesthesia. No privacy. Just you, gravity, and a surgeon with steady hands and questionable lighting. The frame was necessary to immobilize the patient. Pain makes people move. Movement during surgery without anesthesia is dangerous. So they built a contraption that kept you still whether you liked it or not. From a psychological perspective, this is peak vulnerability. Restrained. Exposed. Surrounded. Your brain reads it as threat overload. The amygdala goes into overdrive. Even if the surgery saved your life, the experience likely imprinted deeply into memory. The lithotomy frame looks like an execution device because restraint and exposure are elements common to both punishment and surgery in that era. The only difference was intent. Ancient medicine didn't always look gentle. Sometimes it looked like a crime scene that happened to be medically justified. Number 1. The Amputation Knife. Picture a blade long, thin, and razor-sharp. Not a kitchen knife. Not a decorative dagger. A purpose-built slicing instrument designed to cut through skin and muscle in one continuous motion. This was the amputation knife, and if you saw it laid out on a wooden table, your brain would not assume healing. Before modern surgical saws and sterile operating rooms, amputation was a choreography of speed and brutality. The knife came first. The surgeon would make a circular incision around the limb, slicing cleanly through layers of tissue. Then the bone saw followed to finish the job. It was a two-step dance: slice, saw, survive. What makes the amputation knife especially unsettling is how surgical it looks. There's no mechanical complexity. No gears. No clever engineering. Just a long blade optimized for maximum efficiency. It resembles a weapon because it shares the same design philosophy: clean entry, decisive cut. And yet, in battlefield medicine especially, this knife was often the difference between life and death. Infections spread quickly. Gangrene didn't negotiate. If a limb was compromised, removing it could prevent sepsis. So while it looked like violence, it was actually damage control. Your body in that moment would be in shock, literally. Blood pressure drops. Vision narrows. Hearing fades into a tunnel. The nervous system sometimes dissociates to blunt the experience. Pain becomes distant, almost abstract. The brain's emergency response system prioritizes survival over comprehension. Here's the uncomfortable truth running through all of this. Ancient medical tools look like weapons because, mechanically, they are. They cut, they crush, they burn. The difference isn't in the metal, it's in the intention. Modern medicine hides its violence behind plastic casings, anesthesia, and soft lighting. But surgery, at its core, still involves controlled harm to prevent greater harm. The ancients just didn't bother pretending otherwise. When you look at these tools in a museum, they seem barbaric. But for the people who used them, they were hope forged in iron. Brutal, imperfect hope, but hope nonetheless. That's all for today. I'll be making similar videos in the future. Subscribe to see them.